Hello, thank you so much for joining me today. I am Dr. Melissa Sell, and today's tutorial is all about breast cancer. We are going to be looking at breast cancer through the lens of German New Medicine and the 5 biological laws. If you are new to this material, please watch my tutorial called GNM 101, an introduction to the 5 biological laws, before watching this tutorial. It will give you a lot of understanding and context for the topic we are covering today. This presentation is based on information published on www.learninggnm.com. We thank the author, Carolyn Markelin, PhD, for her consent to use the GNM material, including the subject-related diagrams, for the production of this video. This information is intended for educational purposes only. It is not a substitute for professional medical advice. So let's start with the breast anatomy. So the breast sits on top of the pec muscle, and it is a complex, mostly fatty tissue, but embedded within the fatty tissue are the actual mammary glands. And these mammary glands are what produce breast milk, and they are separated into lobes, which are further divided into lobules, almost like grapes on stems. And so there are connections to the nipple, and those are the breast ducts that carry the milk from the breast, the milk-producing cells, all the way to the nipple for the baby. There's also fibrous tissue, lymph nodes surrounding the breast. There is the nipple that transports the milk to the baby. And this is the area we are going to be studying today. So the breast function is extremely important biologically. I mean, we are mammals after all, and we get that name from mammary. So the breast is a very important function of the human animal. So it's meant for nourishment, to feed our offspring, nurturing, there's connection, cuddle, protection of the offspring, as well as absolutely vital for the survival of the species. And so it's an extremely biologically profound connection between the woman, the breast, and the baby. Let's zoom in at the breast anatomy. Because we are talking about breast cancer today, we want to see what areas of the breast develop different cancers. So first there's the mammary gland. And so the mammary gland, like I said before, is what actually produces the milk. It's derived from cerebellar mesoderm embryologically. So that's the tissue type. And so the cell types are adenoid cells, and this is the oldest breast tissue. And so the different tissues that make up the gland versus the breast duct are related to different biological conflicts. In GNM, all biological special programs are set off by some type of conflict. And that becomes very important as we look at the difference between ductal breast cancer and glandular. So breast duct is the tube basically that carries the milk from the gland to the nipple, and it derives from ectoderm. So it's a newer embryologically and evolutionarily, the cell type is squamous epithelium. And so ductal cancers are much more common than glandular. And when we look at the conflict specifically, you might be able to guess why that is. So the conflict shock for glandular breast cancer is a nest worry conflict. And so Dr. Hammer discovered among women with a glandular breast cancer, everyone had some type of nest worry. And so this is a concern for somebody in your pack. You know, it could be your child, a friend, a spouse, someone who's very close to you, your parent. And so when you are extremely worried about the well-being, about a situation regarding maybe an argument with this person, it could be actually about the nest itself, and you're very concerned and worried about someone in the nest, your body has a very specific response. And so the first biological law, we know that the psyche, the brain, and the organ respond all at the same time. So as soon as your subconscious mind, as soon as your survival brain notices that there is a nest worry, as soon as the signal detection device of your brain notices there's someone in the nest to be worried about, immediately your brain is impacted in the specific area of the cerebellum. And that area of the cerebellum has a nervous system relay to the breast glands, and there is a message sent for proliferation. And so the brain is telling the body to make more breast gland tissues. And this is directed, and this is on purpose by the biology of your body. And the reason is for more milk. Your body is increasing the function and the number of milk-producing cells for greater nourishment for the injured nest member. And so while this may seem kind of strange, why would the body do this? Why would the body make more breast gland tissue? But you have to remember, in the context where this process developed and evolved, it was extremely biologically important and meaningful, because a long, long time ago, when you had someone you cared about, someone in your pack, someone in your nest that was injured, and let's say they were bleeding, and so it would be very important for that person to have nourishment, to have hydration. And you don't have a store on every corner where you could go buy water or Gatorade or coconut water to hydrate that individual. So breast milk is the kind of ultimate super healing food for someone that is injured. And so the body automatically, it doesn't matter if the woman is breastfeeding, it doesn't matter if she's already past childbearing age. This is an age-old biologically meaningful response of the breast gland tissue to respond to a nest worry, to this type of concern. Laterality. Now this has to do with which breast will develop cancer when a woman has a nest worry. And so this is wired into you. Your laterality, it sometimes correlates with what hand you write with, but not always, because sometimes people will be trained to write with the opposite hand that is dominant for them. And so your laterality was actually determined at your first cellular division when you were an embryo. And so a biologically right-handed person, when they clap, they'll naturally put their right hand on top. Left-handed, you can test, and you would be most comfortable in that left hand on top position. Now, a right-handed woman, she biologically associates her left breast as her mother-child side, because a right-handed woman, biologically, her body associates the baby with the left, because she'll hold the baby on the non-dominant side so that her dominant hand is available for doing other things. And now, so if the concern is with her right breast, that is going to be linked to her partner or someone who's not her mother or her child. And with the left hand, it's going to be the opposite. So we are going to look at the second biological law in the context of a glandular breast cancer that comes from a nest worry conflict, and look at the specifics of what happens. So when a person is conflict active, in that conflict active phase with the nest worry, they are in a state of sympathetic dominance. And so the body, it knows that you're concerned, it knows that you're worried, and so your body is utilizing all of the resources to help you resolve this conflict. So that's why you can't sleep, or that's why you go to sleep and you wake up at 3 o'clock in the morning and can't get back to sleep. You don't have an appetite, you've got cold hands and feet, you're restless and nervous, possibly losing weight, you're just like in that worry mode, shivering, higher blood pressure, you're jumpy, and so your psyche is preoccupied with whatever this person is that you are concerned about, whatever this nest worry is. But apart from this stressed out, worried feeling, there are no physical symptoms of the breast gland proliferation. You can't really tell that it's going on, but it is. And so if a woman just has a routine mammogram during this time, a tumor may be found if the nest worry has been going on for a long period of time, enough for it to build up a tumor. Now, the tumor itself, or the breast gland proliferation, it grows in proportion to the intensity of the conflict. So if it happened all of a sudden and it's a really intense conflict, the tumor will grow larger for that reason, because again, this person, they're in serious trouble, it's happening now, we need this additional breast milk. And so if it's found by conventional medicine during this stage, and if the tissue is viewed, they will find that it is in the stage of proliferation. Now, conventional medicine sees that as a metastatic cancer, and that being diagnosed with something like a metastatic breast cancer during this stage can induce an additional conflict, which we'll discuss a little bit later on. And so remember, the brain is always impacted. It's going to be in the cerebellum, and a CT scan would show a sharp ring configuration around the right or left region of the cerebellum. Now, conflict resolution is something we want to reach as quickly as possible, especially when you become aware of GNM and the 5 biological laws. You have this heightened awareness of how your perception of the world is impacting what your body is doing and how your body is trying to help you. And so resolving conflicts is the major work, because you can't necessarily avoid these things from happening completely, especially because it's so deeply programmed into you. But it's just that awareness of when a conflict occurs and your ability to find peace of mind, to experience an emotional release. A natural resolution is typically the best resolution for a conflict. So say if it's an injured child that, the child ends up being totally fine, that's a natural resolution. But sometimes things that can't naturally resolve, say if someone passes away, there's acceptance, forgiveness, new perspective, understanding yourself and others, shifting of priorities. And so this is really the major work in GNM, is this ability to recognize and resolve conflicts quickly so that you aren't stuck in that sympathetic adaptation mode for extended periods of time. Because once you get through the conflict resolution, your body immediately begins healing. And in the healing phase, this is where symptoms show up. Remember, when you're in conflict activity, you're stressed out and worried, but you don't have bodily symptoms for the most part. But now when you get to the healing phase, this is where the body has to repair what was going on during conflict activity. So, when you're in conflict activity, that's an abnormal state for the body to be in. It's an adaptive state. So now the body wants to get the tissue back to normal, back to just normal function. But there are some things that have to happen in order for you to get back to normal everyday function. And so the tumor stops growing immediately as soon as you resolve the conflict, but there may be enlargement in the breast due to swelling. All healing happens in a fluid environment. And so there is swelling in the area of the breast, also on the brain level. There's heat, so you may have a fever. The breast itself might be warm. You might notice some changes on the skin. You may have swollen lymph nodes underneath your arm on that associated breast. You may have sharp pains in the breast. And the signature, kind of the key sign that you are healing from a glandular breast cancer, are the night sweats with a foul-smelling discharge. So the amazing thing about what happens during this phase is that your body, again, it built up this tumor for a very specific purpose, and it has a plan to get rid of it when it no longer is needed by the body. And that way that it does it is using bacteria. So bacteria are in our tissues all of the time. They are there and they're dormant. They're not doing anything until you reach a healing phase. And then the brain actually tells the bacteria to get to work. And so that's where the tubercular bacteria, fungi, and other bacteria start to decompose the tumor. And so this decomposition, there's a lot of byproducts. And so that byproduct is drained through the lymph, and that's why you may have swollen lymph nodes. That byproduct sometimes leaks out of the breast, and it has a smelly discharge because that's the tubercular bacteria. It's, it's decomposing. If you've ever, had a compost bin, when there's decomposition, it doesn't smell very good, but it's doing a very wonderful thing. It's breaking down that tumor. And so if that is going on, if you have night sweats even one night, make sure you're getting plenty of protein, because during the breakdown process, TB bacteria need a lot of protein. And so during the healing phase, rest, nourish your body with good healthy foods, good healthy proteins, and your body is doing exactly what it needs to do. Now, if there is no bacteria available, the tumor cannot break down. Therefore, it will stay in place, and it may be found later on. So once you're halfway through the healing phase, so you reach the greatest amount of swelling in the breast and on the brain, and then there's something called the epileptoid crisis. And so this happens in every healing process, and it's a sympathetic stress push. So it's the turning point where the healing phase, enough fluid has built up, there's been enough amount of healing, and so now we want to squeeze out the edema. And so the way that you'll know that this has happened is if you get chills, you're feeling really cold, maybe you've got some sharp, severe pains in the breast, and then you've got increased urination. That means you've made it through the epileptoid crisis and your body has got to the turning point of the healing phase. And so the last half of the healing phase is the scarification. And so this is where everything's resolved. You made it through the epileptoid crisis, and now there may be caverns. So there's caverns where the tumors once were, open areas that get filled in with calcifications. These calcifications can be seen later on mammogram. That's the image that you see there, and they will be called macrocalcifications. And so it's so good for a woman to be aware of this, so that if she does get a mammogram later on and her doctor says, oh, you've got some calcifications, that she's not concerned about that she understands, oh, you know what, that must mean I had resolved a nest-worry conflict. And you know what, I actually remember that time I was really worried, and I was feverish, I did have some pains in my breast, and so you may be able to link this to things that have happened. Now, like I mentioned before, if there's no TB bacteria, the tumor will encapsulate. And this is what we call a benign tumor. So when they biopsy it, they look at it and they say, oh, well, the cells aren't replicating, they're dormant, so it's just a benign tumor, a fibroadenoma, and, you may still be concerned about it because you're like, oh my goodness, how could that be, in my body? Why is that there? That does cause some people to be concerned. But when you understand what is happening and what that tumor means, what that benign tumor represents, you can feel at ease. And that's what all of this work is about. That's why I, am teaching this, because I want people to understand what's going on in your body, so you realize that there's nothing to be afraid of. Your body isn't turning on you. Your body is just going through processes that we previously didn't know what it was doing. Now also the brain, at this point, there will be healing glial restoration to the area of the cerebellum that was impacted during the conflict activity. And so overall, the body is just getting everything back to normal, and so there are signs that something happened, but we're getting all of our functions back to the normal state. So let's discuss potential complications that can go along with a glandular breast cancer. So one of the major ones is a self-devaluation conflict. When a person is devaluing themselves, the body is also responding to that conflict of not feeling good about yourself, of this self-worth, self-devaluation that can come along with a diagnosis. Now, it may affect the bones, it could affect the lymph, it may affect the fat tissue surrounding the breast itself, and these are all different conflict programs. And so they are all things that I will do in-depth presentations on what the bones do when you have a self-devaluation conflict, what the lymph in causing something like a lymphoma, what the lymph is doing, what the fat cells are doing. And so those are all very specific types of self-devaluation and how the body interprets it. There's also the program of the skin. And so in addition to the nest-worry conflict, you could have an attack or disfigurement conflict due to having a biopsy on the breast, perhaps having a mastectomy and the scar, and that may cause a melanoma, feeling disfigured. You could also have a conflict of the actual corium skin on the breast itself, which could be diagnosed as a skin tuberculosis. And so this is just to keep in mind that you can have multiple conflict shocks going on at the same time, which from the conventional medicine point of view, it looks very much like the cancer is either spreading around to all these different areas, but what's happening, it's the complexity of the human individual and the way that they are seeing their situation and the way that they're, experiencing the cancer, the way they're experiencing themselves. And so that's why there's so many different things that can go on. One of the most serious types of complications is this kidney collecting tubule syndrome, and this is a syndrome involving the kidneys, and it causes the body to retain water. When you are having an existence conflict, when you are having an isolation or abandonment conflict, it's an extreme fear and panic response of the body to retain water. So again, this has a biological purpose all of its own. It's kind of the fish out of water. Your body, to protect itself, is retaining water. However, this water retention, when you are in extreme fear and panic, it complicates every aspect of healing. So remember, all the healing is happening in a fluid environment on the brain and on the breast. If you are in extreme fear and panic due to an existence conflict, the breast is going to swell even more. The swelling in the brain is going to be even more. More swelling means more pain, means potential ruptures. Those caverns that were left behind after the TB bacteria ate away the breast cancer tumor. So those caverns, they could get filled with fluid because you are in extreme fear and panic and there's increased fluid, and that may get diagnosed as a cyst. And so that may scare the person once again. And so you can see how when you don't have a full understanding of the 5 biological laws and why your body is doing what it's doing, there are so many different reasons to get freaked out, to get scared, to feel bad about yourself, to feel, attacked, to have all of these different conflicts. And so it's understanding the complexity of an individual and how they see themselves in the context of their situation. So this is just all something to keep in mind when either you are dealing with a breast cancer diagnosis, somebody that you care about, and all of the things to be aware of from their perception and how it could be causing additional conflicts. So let's move on now to the more common type of breast cancer, which is cancer of the breast duct. And the conflict shock that is associated with the ductal breast cancer is a separation conflict. And so the thing that the psyche is picking up on is something has been torn from your breast. And so that torn from my breast phrase is very important in understanding how the body is interpreting the separation conflict. And so this commonly happens with unfortunate events like a miscarriage or a stillbirth, the loss of a child, even an abortion, a divorce. So, think about how many women have experienced a divorce, a breakup, a betrayal, shocking or profound loss or death. So you just feel like this person was just torn away from you, loss of the home, or it could be wanting to separate. And so the body is going to do something very specific when it perceives a separation conflict. So the psyche perceives the separation conflict. It's impacted. The area of the brain associated with this is the cerebral sensory cortex, and the organ is the duct lining. And so there is a message sent directly to the lining of the milk duct, and the purpose of this erosion is to widen the opening to drain off the milk. Because again, biologically, how your body's interpreting this is that this offspring, this this person that you love, this baby, was torn from your breast, is lost. And so biologically, the body says, okay, there's no baby anymore, so we need to widen the breast duct lining so that there is a greater opening to pour off the breast milk so it does not get congested in the breast. Again, this doesn't matter if the woman, if it does actually have to do with a baby, because our minds think in these symbolic ways. It could just be symbolized to you in the body, the way the body is interpreting it as torn from my breast, a baby. But it could be, again, it could be a friend, it could be a spouse, it could be somebody that's not your actual baby, but the body will still respond in the same way. And so laterality is also at play in the ductal cancer. So if it is the baby of a right-handed woman, it will be her left breast, the left breast duct that is affected. Or if it is a partner, so in the case of, say, a divorce, it will be for a right-handed woman, the right breast, and then opposite for the left. So let's go through the second biological law for the ductal cancer and what kind of symptoms and things we have going on. So first, there is the psyche level. So the person, the separation happened, the miscarriage happened, the loss, the divorce, you just found out about it. So you're preoccupied with this, with the separation conflict. And your body physiologically is in sympathetic dominance. So you're having trouble sleeping, cold hands and feet, nervous, restless, in this worry mode. But typically you aren't feeling any symptoms of the erosion of the breast duct, and it normally just goes unnoticed. And there's no test that we do to see if there's any erosion in the milk duct lining, and so it's typically never found when you're actually conflict active with a separation conflict. Whereas with the glandular, remember, because there is cell proliferation in the conflict active phase, it could be found during a routine mammogram. Here, you're not going to find anything. If the conflict has gone on for a while, let's say that it's not resolved, there may be a loss of nipple sensitivity, because this the separation conflict has to do with this ectoderm. And so ectoderm, the program, there is loss of sensitivity, even short-term memory loss, which is very interesting. Cats, if they lose one of their babies and the baby is actually returned to the mother doesn't remember the baby, because this short-term memory loss, it's biologically important. It helps to decrease the trauma, decrease the severity of this separation for the woman to have, for the mother to have a short-term memory loss. So if the conflict's been going on for a long time, and there's a lot of erosion in the duct itself, it can actually kind of suck the nipple in, causing an inverted nipple. We'll talk about a few of those things when we get to the complications. But the thing to remember is that, the psyche's being affected, there's an impact in the cerebral cortex, which could be found on CT as a sharp ring configuration, and then the ulceration of the milk duct lining in proportion, again, to the intensity of the conflict. Conflict resolution, very similar to what we talked about with glandular. The natural resolution, say for a woman who's experienced a miscarriage, would be to become pregnant again. That's a natural resolution to resolve the upset and the trauma that is associated with that separation. And perhaps if that's not happened, an emotional release, acceptance, forgiveness. And so this a lot of times is that work in understanding yourself and finding a way to make peace with the situation so we can resolve the conflict as quickly as possible and move into healing. And now, this is when typically a person thinks they have cancer, is when they get to this first half of the healing phase. Because you see, when you feel, in your breast, hot, red, swollen, very itchy, you might have a skin rash associated with it, hypersensitivity, because there was kind of a numbness, a loss of sensitivity during the conflict active phase. Now that we're in healing, we're hypersensitive. There's swelling around the entire area. Remember, all healing happens in a fluid environment. You may have clear or bloody secretions. And so just think about the lining. So you've got this opening. There was erosion, so it got wider. And now, essentially, the cancer, what we're calling a cancer, it's like a scab. It's a healing restoration of this epithelial mucosa. And so the cell proliferation is there to fill it in. So if you've ever had a major, cut or wound, there's cells that are growing in that area. They're replicating, and you want that to happen. Why? Because you want to heal that area that was injured. And so that is how I want you to think about a ductal breast cancer, as a healing scab, as a healing tumor. And so again, if you go and you are being checked out by your conventional medical doctor and they test these cells, they're going to say, well, these are malignant cells, because they're replicating, they're dividing, more and more cells are coming to this area. But again, this is not random. This is for a purpose. This is for healing. And so if the conflict had gone on for a really long time and there was a lot of tissue that got eroded, this healing is also going to take time. And so for the healing phase of the ductal cancer, you actually won't have the night sweats, because there's no tubercular bacteria involved, because this is a newer type of tissue. So the breast ducts, when healing, they may use some bacteria and possibly viruses, but there's no TB bacteria, so you won't have the night sweats here. On the brain level, remember, there's also fluid coming to the brain itself, so there'll be this diffuse ring instead of a sharp ring if you were to look at a CT scan. So the epileptoid crisis related to a ductal breast cancer, you'll get this pulling pain in the breast. If it's a severe conflict and it went on for a long time, you may have dizzy spells, fainting, circulation issues, some acute pain, or even a drop in blood sugar when you have your epileptoid crisis. But again, this is that sympathetic stress push. And if you know what to expect, if you are aware of the process and you kind of know where you are, you know you haven't made it to the epileptoid crisis. If this does happen, if you get a little dizzy, if you kind of like, aren't feeling all there, and you get really hungry all of a sudden, you're like, oh my goodness, you know what? Must be the epileptoid crisis, that turning point. And then you look for increased urination, because there's always increased urination after this crisis because we're removing fluid from the body. So this is what happens in the second phase of healing. It's the scarification phase. And so this is a sign of a resolved separation conflict. And so these are like at the end of the milk ducts. So there's little bits of milk that get backed up into the duct itself, and these form these microcalcifications. And this can also be spotted on mammogram. Unfortunately, conventional medicine will see these as an early sign of breast cancer and may kind of go a radical route and treat this with a mastectomy. But we know that this is the sign of a healed and resolved separation conflict. And there's also healing glial restoration at the brain level. And so that's the finished separation conflict and what we get at the end. So just like with glandular, we also have potential complications. Self-devaluation is definitely an issue. Guilt associated with the separation. The skin may be involved around the nipple. You may have some eczema around the nipple. Healing may be actually considered another disease from conventional medicine, and they may call it Paget's of the nipple. So the serous knots, it's when the milk duct is continually being eroded, potentially due to a hanging healing. The tissue starts to contract and the breast overall can shrink. And we mentioned before how the nipple can actually get sucked into that space and cause inversion. The syndrome, the kidney collecting tubule syndrome, is also at play here because if there is extreme fear and panic, there's also that water retention. This can cause, so you've got this healing, imagine, a scab down this main duct of your breast. Discharge can build up behind the nipple, especially if there's a lot of fluid retention due to the syndrome. And so the fluid can't get out, and so it stays back behind there. Dr. Hammer actually suggests, if this is the case, to use a breast pump to pull the fluid out so it does not get stuck behind in the breast, because if it doesn't get drained, it may cause a shrunken cirrhotic breast after the fact. So let's talk about a hanging healing. You heard me just mention that. And so there are two charts here on the right. The top one is the hanging healing when there is not a conflict resolution. And so this is a person who's been conflict active for a long time, and they either, are so upset that they just can't find a resolution to their issue. Again, it could have been this separation, this loss, the nest worry, and it just doesn't get resolved. And so the concern here is this continual change in the tissues from being in conflict activity for so long. And then there's also the possibility of a hanging healing where you do actually resolve the conflict, but there are tracks and triggers that put you back into conflict active mode. And so the concern with this one is that when your body was going through this initial conflict, it takes a snapshot. And this is very important from an evolutionary perspective. Think about, if you're in the wild and something traumatic and shocking happens, your body is going to want to know the cues and the clues for if this is going to happen again. And so the body takes a snapshot, and it takes a snapshot of everything. The foods you were exposed to, the smells, the sights, the everything. And so your body, if it comes across a track again, will automatically go back into conflict activity because it's saying, wait, last time we were here, last time this happened, last time we saw this, there was a severe conflict. And so when you relapse back into conflict activity, you are reactivating, whether it's the cellular growth or the cellular loss. And so paying attention to this is an important part of working with a coach and working just with yourself, of figuring out what causes me to go back into conflict activity. And as you're paying attention, you will know. You'll start to feel emotional with a certain when a certain song or a certain smell, or you drive by a certain place, you get cold hands, maybe your heart rate goes up, and you just have an uneasy feeling. And so being aware of these triggers and learning to neutralize them is the key to making it through the entire healing phase. So just kind of think about it as scratching the wound. When you take the scab off, you know that the healing is going to be prolonged. And so this is such an important thing to be aware of. I wanted to briefly mention male breast cancer. Although it's extremely uncommon, less than 1% of breast cancers are male breast cancers, but men do have mammary tissue. It's not active because of their testosterone level, but men occasionally may have low testosterone due to a loss conflict that affects the testicles, or it could be another conflict that is inducing hormonal imbalance. Men can also suffer nest worry or separation conflict. So it'll follow the same program, just like the glandular or ductal female cancers. So the third biological law, this is just a cool thing to look at when we're looking at the breast tissue. This is that compass of German new medicine, that the oldest tissues, remember the endoderm and then the old mesoderm, during conflict activity, there's cell proliferation. And with the newer tissues like the ectoderm and the young mesoderm, during conflict activity, there's loss of cell tissue, there's cell ulceration. And so that's how we know that there are these different phases. There's different ways to know where you are, what tissues are being involved, what conflicts are involved. And that's just the amazing thing about this model, this paradigm of understanding the body. We have an understanding for why each of these things is happening. You know, remember I mentioned the bones, so the bones have to do with a self-devaluation conflict, and the purpose is so that afterwards they are stronger than before. And so all of the tissues in your body, follow along these lines. It's their roots, it's where they came from, it's their embryological connection and their evolutionary connection. When did they form? What was important to those organisms at that time? Was it just breathing, food, and reproduction? Those are those old primal programs, and as the body became more complex, as we started to develop this mind, that's why the ectoderm has to do with social contracts. So this is just such an interesting thing to look back on with each of these conflicts that we are encountering, so we have this deepened understanding of the body and what and why it's doing what it's doing. Now, the fourth biological law, this was when we talked about the tubercular bacteria. This is the ontogenetic system of microbes and how important microbes are to our healing. They're so important for this healing of a glandular breast cancer. They optimize the healing phase. The brain, when you move into healing, that bacteria was there before. If you tested your body right now, there's so much bacteria that conventional medicine would say, oh, well, that's a pathogenic bacteria, tubercular, staph, strep. And the previous assumption was that the immune system just keeps those ones in check. But sometimes they get activated, or your immune system goes down, and so then you are, quote, infected. But really what's happening is your brain is running the show the whole time. The brain knows the bacteria is there, it's supposed to be there, and when you make it to the healing phase, the body says, okay, bacteria, get to work. And bacteria are best able to work in warm acidic tissues and warm and acidic wet environments. That's why there's fluid, you got this fever. People have associated, cancer can only grow in an acidic environment. But really what's happening is there are bacteria, there are things going on that we are not aware of. And so when we try to artificially, alkalize our body in an attempt to kill bacteria or to kill cancer, get rid of cancer, it's just a misunderstanding of why the body is warm and acidic during this particular phase. And remember, if the bacteria aren't there, the tumors will encapsulate. And so they will stay there. And in the breast, it's not all that big of a deal because the breast won't block anything from passing through. But, if you think about the digestive system, encapsulated tumors potentially can actually block passageways. And so that's something to keep in mind for different types of cancers that are more vital. So the breast itself, there isn't the potential for any kind of blockage since it is separate from the internal organs. But so that's really important to keep in mind. So the fifth biological law, this is just kind of that overall, that big picture, that awareness that breast cancer is not an error. You know, it's not because you had a bad lifestyle. It's not because, you didn't eat good for 20 years. It's because your body is not making a mistake. These are programmed into you. Your body has a plan for breast cancer tumors. It's got, it builds them for a reason and it breaks them down. And the ducts, it builds, it breaks down the tissue for a reason and it builds it back up. And this is programmed so deep within you to serve these specific survival functions. And that's the beauty of the new medicine. That's the beauty of the work that Dr. Hammer did, is making you aware of this so that you do not need to fear. You don't need to fear. And regardless of what you choose to do about it, knowing this perspective, and to me, it just makes so much sense that you can trust your body, that it knows what it's doing, that, it does not want to kill you. The body is programmed for survival so that we can have more kids and repopulate the earth. And so those kids can have kids. And so it just makes so much sense that cancer isn't there as this malignant evil disease that just wants to kill you early. It's just been misunderstood for a very long time. And so that's why I am making these videos to clear this up. Thank you so much for watching. Please share this with someone who you think could benefit by this different understanding of breast cancer, this understanding of the 5 biological laws. And so stay tuned on my website, on my Patreon page, follow me on Instagram, feel free to send me an email if there is a particular topic you'd like me to cover in more detail. New videos come out every Monday, so stay on the lookout. Thank you so much again and have a great week.